Hi everyone, Dr. Jeff back with co-op student Noah this week, and Noah, we've got a good topic this week, I think.
Yeah, so based on our past video on the autonomic nervous system, now we're going to be talking about what chiropractic can do for the ears and sinuses.
Yeah, so back in the day, I used to treat a lot of kids. They come in and, ear infections is a big thing they come in with, and some of this is because with babies and small kids, the eustachian tube, which drains the inner ear into your sinuses, is more flat. Their heads really haven't developed their shape yet. It's not large enough, so it's kind of flat instead of angled like this. And so a whole bunch of stuff kind of flows back and forth with that, especially when they blow their nose. If they blow their nose, quite often the stuff goes the wrong way. So it's back up the eustachian tube, it gets into the inner ear, kind of sits in there, ferments, lots of bacteria starts to grow, and you end up with an ear infection. Back in the days when my kids were small, they used to give us some sort of antibiotic to help with it. They don't like to do that much anymore, so now you kind of have to ride it out with some Tylenol and just reduce the pain. If it's something that's repetitive, they get lots of ear infections. I think they still kind of put tubes in the ears.
Yeah, and around this time of year, there's a lot of stuff blowing around in the air, such as dirt and dust. You might be having seasonal allergies, or your kids may be bringing sicknesses home from school. So I was wondering, what does chiropractic do for the ears and sinuses?
Well, again, we looked at the chart we had a couple weeks ago in our last autonomic nervous system video. The upper cervical, so C0, C1, C2, so kind of at the top up here, if you look at the chart, that's kind of more, does a lot of things, but ears is one of the things that included in that. And I have found from my past experience of treating this with little kids, of working on that area, can really help with reduce the ear infections and also help prevent the further ear infections. I also found that people come in and they've got sinus issues one side or both sides, and they're all plugged up. That if I do a sitting cervical adjustment for that, we can really drain those sinuses. Usually after an hour or two of getting adjusted, the sinuses drain out, and you can breathe a lot easier. So usually for sinuses, I've found doing a sitting cervical adjustment is more beneficial than doing it lying down. I don't really know why. I just found it works better for me. So generally, the upper cervicals are going to be up, kind of turning this way here, going to be up in this area here. So when I'm palpating, I'm kind of palpating along, trying to find and see if there's anything locked in there. And quite often, if I'm palpating, I can usually tell which side is going to be a little more blocked than the other side. So if I'm palpating here, I can certainly feel something a little more there versus this side here. I don't really feel anything in there, but I certainly feel a little something on this left upper cervical, right about there, Noah?
Mm-hmm.
So I feel there. So if Noah has a sinus issue, it's probably the left sinus seems to be more of the issue. So for me, I just come in here, I kind of cup, don't try this at home, by the way. I kind of cup over, I get the C2 there. He's going to look up at the ceiling, and all we're going to do is that. All right, didn't hurt?
Nope.
So that's all the adjustment is about, and well, that's much better now.
Yeah.
And that would clear the sinus. So usually some people instantaneously before they leave the office, they're blowing the nose. Other people, it takes an hour or two, but by then they can breathe a lot easier.
Alright guys, I hope you enjoyed this video this week. If you have any questions for me or Dr. Jeff, leave them in the comments down below, or any future video ideas. Make sure to hit that subscribe button and smash that like button as well. And here at Goldsworthy Wellness, we got your back.